Perfect. Thank you. So good afternoon, everyone. Thank you so much for allowing me to join you today at the Advocates for Children of New Jersey Parent Lunch and Learn. I do have notes, so if I'm looking down, that's what you're seeing. My name is Heather Nover. I am the Executive Director of the Anshe MF Community Development Corporation, which is a 501c3 nonprofit organization. Our signature program is the Central Jersey Diaper Bank. We provide free diapers, wipes, formula, and other baby essentials to families living across central New Jersey, including Middlesex County and Franklin Township. So I want to start off by telling you a little bit about what we do at the Central Jersey Diaper Bank. Families can receive diapers from our organization in one of three ways. Families can pick up diapers at our offices Monday through Thursday from 10 a.m. to 12 p.m. Families can also attend monthly distribution events in which we are joined from by partners across the county who share resources and education with families. While the partners that do attend rotate, we have been joined by organizations providing hot meals, non-perishable food, blood pressure screenings, vaccines, signing up families for NJ Family Care, and giving information on topics like preschools, eradicating lead-based paint, breastfeeding, and patient advocacy. At these events, families also receive diapers, wipes, and formula. We have these monthly. Normally, it's the first Thursday of each month, so we have one tomorrow. We also have partnered with several agencies across our area, such as local family success centers. So Bayside Family Success Center in Perth Amboy and Greenway Family Success Center in Avenel. And we provide diapers to the families they serve through a bulk distribution model where they place orders with us and we give them the diapers to then distribute. So now that I've told you a little bit about my organization and the work that we do here, I do want to take a step back and look at the broader picture of diaper need and how it impacts families across New Jersey. So in this presentation, we will discuss a couple of different things. So the first is the definition of diaper need, its impacts on children and families, statistics about diaper need in New Jersey, and some steps that are being taken and can be taken in the future to help address diaper need. After I present, I look forward to hearing your thoughts, questions, experiences, and ideas. Much of my presentation is informed by information that is provided by the National Diaper Bank Network, which is an organization dedicated to helping individuals, children, and families access the basic necessities they require to thrive and reach their full potential. I am also thrilled to share that Lacey Garrow, the manager of state policy at the National Diaper Bank Network, is on the call with us today. So you might get a chance to talk to her a little bit later. So let's talk about diaper need. Diaper need is defined by the National Diaper Bank Network as the lack of a sufficient supply of diapers to keep a baby dry, clean, and healthy. So diaper need can lead to serious health problems for babies and emotional stress for their families. We will discuss some specific impacts of diaper need in a few moments. But before that, I would like to state some facts about diapers. 1 in 3 American families struggle with diaper need. Infants require up to 12 diapers a day at a cost of around $70 to $80 per month per baby. I think I've blocked that time period out from when my daughter was a little baby because it was a long time ago. As we have seen many costs rise across the board, diapers are no exception to this. An analysis of diaper pricing at Target shows an increase of 23% in the cost of diapers between November 2021 and November 2022. And I just also want to point out that diapers are expensive, but even more so for families that either A, can't afford to buy in bulk, or B, don't have access to big box stores like Walmart or Target. So if you think about a family going to the Walgreens or the Rite Aid on the corner in New Brunswick, they're going to spend a lot more for diapers than I'm going to buying a ton of boxes from Target, for example. This makes diapers even less accessible to families who do struggle to afford these necessities. So when we're talking about policy, this is a great place to start. Despite the fact that diapers are a basic necessity for infants and toddlers, they are not covered at all by the government assistance program SNAP, which is Supplemental Nutrition Assistance Program, or WIC, Women, Infants, and Children. While diapers are an allowable expense for the TANF program, which is Temporary Assistance for Needy Families, families experiencing diaper need in New Jersey spend approximately 14% of their TANF benefits on diapers, and that's if they even have TANF. So I want to talk about the impact of diaper need on babies. Diaper need has a tremendous impact on the babies that are affected by it. Children experiencing diaper need can be left in wet or soiled diapers for hours. Sometimes families can only have enough diapers to change the baby once that day because the family doesn't have any more diapers available. As a result, these babies can get diaper rash, skin infections, urinary tract infections, and other health issues that could be severe enough to result in hospitalization. Diaper need also causes tremendous stress on the family system and has been linked to child abuse and neglect. Something that advocates working to end diaper need often talk about is the requirement that daycare providers have for families to provide disposable diapers. So even when some of these programs are grant subsidized, families are still required to bring diapers. Most of these daycare providers require that at least a day's worth of diapers be provided in order for a child to attend daycare. Sometimes families just don't have those diapers to be able to give. So when the child cannot attend daycare due to a lack of diapers, they miss out on pretty vital early childhood education. And I like to point out that this could also result in missed opportunities for early identification or intervention for educational or developmental needs that the child might have. When thinking about diaper need, though, it seems very instinctive to focus on the impacts of diaper need on babies because they are the ones wearing the diapers. However, diaper need does impact the entire family, including parents. At the Central Jersey Diaper Bank, 97% of the adults that receive diapers for their family identify as women. That's important for us to note because in one study, researchers at Yale found a strong correlation between diaper need and increased maternal depression. So there are mental health connections happening when families are experiencing diaper need. Diaper need also impacts the parents' abilities to work. I will also address this when we're discussing the New Jersey state statistics, but for the moment, I would like to point out that, as mentioned above, most daycare providers do not allow children to attend without a full day supply of diapers. And as you can imagine, when a child cannot attend daycare, it can impact their parents' work attendance. In a 2020 National Diaper Bank Network national report, 57% of parents experiencing diaper need who rely on childcare to work said that they missed an average of 4 days of work in the last month because they did not have adequate diapers. Obviously, missing work leads to a loss of income, but it also could jeopardize the parent's employment. So something I like to point out when we're talking about diaper need is that, at the Central Jersey Diaper Bank, we see parents and caregivers daily who are making impossible choices. When there's a finite amount of money in the bank, families need to choose among which expenses they can pay. Do they pay their heating bill or the bill from the pediatrician? Do they pay rent or buy food? Each of these decisions is extremely difficult and they can have ongoing repercussions. If the heating bill is paid, but the pediatrician is not, that account could go into collections. The child might need to start going to a new doctor. If rent is paid and less food is purchased, then there's a place to live, but there are potential health issues due to lack of nutrition. The families we work with are making these impossible choices every day. The families that we provide diapers to report that the money that they save is money that they spend on rent, heat, food, or medical expenses. So I want to talk about New Jersey statistics. These statistics have been provided by the National Diaper Bank Network study of diaper insecurity, health, and economic mobility in the United States. They surveyed families receiving diapers from diaper banks across the country, and they compiled the data. They also broke the data that they received into state-specific information. At the time of the study, 299,837 children under the age of 3 were living in the state of New Jersey. 15% of these infants and toddlers live at below 100% of the federal poverty limit. 31% of these infants and toddlers live below 200% of the federal poverty limit. So when we're talking about the federal poverty limit, the 2023 poverty guidelines for the 48 contiguous U.S. states and the District of Columbia are here. At the Central Jersey Diaper Bank, what we have found is that 92% of the families that we serve report incomes of $30,000 or less, and that's regardless of their family size. So to use this chart as an illustration, a family of 2 parents and 2 children would have a poverty guideline of $30,000. So when we're talking about living below 100% or 200% of the poverty limit, this can give you a little bit more of an idea of what that looks like. So now we're going down from general New Jersey statistics to the statistics of the households that are using diaper banks. In the same study that I discussed earlier, of the households using diaper banks, 53% of them reported incomes of less than $25,000. 97% of these households reported incomes less than $50,000. And it's also important to note that 92% of the families that are receiving diapers in New Jersey are working. However, let's look at some financial information. According to the study, the minimum hourly wage in New Jersey is $14.13. Based on the MIT Living Wage Calculator, which is a really good way to kind of look at equity across payment and across wages, the living hourly wage for a family of 4 in Middlesex County with 2 adults both working and 2 children is $30 an hour. And that's the minimum to live reasonably, not extravagantly, just to live and have your needs met. So additionally, of the households that are using diaper banks, 71% of the families that use childcare rely on that childcare so that an adult in their household can go to work. Additionally, 1 in 10 of the families use childcare to allow an adult to attend a school or job training program. As mentioned earlier, when I was discussing the impact of diaper need on parents, you can see how a lack of diapers can lead to a lack of daycare, which then results in loss of working days or loss of educational experiences and job opportunities. So this is where kind of everyone comes in, really is addressing diaper needs. So how can diaper need be addressed? One way in which diaper need is being addressed pretty directly is by diaper banks and other organizations like the Central Jersey Diaper Bank. I will also show you a list of these organizations in New Jersey in a few moments so that you have that. But first, I want to talk about the last 2 items on this list. Donations and financial support are a critical way that you can support your local diaper banks. Donations and financial support by individuals make a tremendous impact on organizations like ours. Other ways to support diaper banks are by hosting diaper drives, which are nice because they give people that don't want to necessarily give money the opportunity to give diapers and make in-kind donations such as that to the diaper banks. We've had diaper banks held for us by the Girl Scouts, schools, places of worship, gyms, and we're actually having a diaper drive in conjunction with the State Theater in New Brunswick over the summer when they're doing their free summer movie program, which we're very excited about. Another great way to help address diaper need is by advocating for policy changes. One area in which we are pretty lucky in New Jersey, and not really lucky, it came from a bunch of hard work and advocacy, is that diapers here are not taxed, which they are in many other states. But there's still a lot more to be done. 2 examples of areas in which advocacy is needed at the state level are state assistance for diaper distribution organizations. Right now, 9 states allocate funding. Some of that's through budget lines, some of that's through laws, but they allocate this funding to organizations for distributing diapers. Unfortunately, New Jersey is not one of those 9 states. Another area in which advocacy is needed at the state level is providing direct assistance to families specifically for diapers, such as vouchers or direct distribution of diapers. Washington and California are 2 states that do provide that assistance directly to families, but New Jersey does not. There's also a lot to be done at the federal level, which is way more complicated than I can necessarily get into. But Lacey, as I said before, is on this call, and she is the pro with all things policy related. So as promised, here is a list of the diaper banks in New Jersey. As you can see, there's only 9 organizations listed here, yet New Jersey has 21 counties. So we're all here and we're trying our best and working really hard, but there's so much more to be done. One thing that to note is that different diaper banks do different ways of providing services. At the Central Jersey Diaper Bank, we provide our diapers directly to clients using a direct service model, in addition to distribution through partner agencies. Some of the other agencies use solely a partnership model in which they do not distribute diapers directly to clients, but rather to partner agencies who then distribute the diapers. So these aren't necessarily all places that you can call and say, hi, I know someone that needs diapers. Can they come to you and get them? Not all of them are able to, but they can also, we all talk. We can, put you in touch with someone else. If you have any questions that are about any of the services provided by any of the diaper banks, you can visit. I have the website here at the bottom, nationaldiaperbanknetwork.org/member-directory. You can click the red area is all hyperlinks, and you can click the links to visit each organization's specific website so that you can learn more about them. If you have one that's closer to you, for example. So kind of my conclusions, and I'm really looking forward to our conversation. Diaper need is a serious issue that does affect families in New Jersey and impacts this entire family system in a variety of different ways. And finally, supporting organizations that do provide diapers to families in need and advocating for policy changes can help address diaper need in New Jersey and improve the lives of families and babies. So thank you so much for your time today. I really appreciate it. And I look forward to hearing everyone's thoughts and discussion.
Hannah, stop the recording.